Good morning, and thank you all for attending our first ever Cancer Survivorship Seminar. My name is Lena Nehru, and I'm the Oncology Certified Clinical Social Worker at Wellstar Kennestone Cancer Center. I'll be your moderator for this program this morning. We will have everyone placed on mute while the speakers are presenting. If you have a question, please write it in the question and answer section of Zoom or in the chat section of Zoom. Our moderators will ask your questions to the presenters at the end of today's seminar. A brief survey will be sent to you after the presentation, so please look out for it. Thank you. I would like to introduce Dr. Bruce Gould, who serves as Medical Director of Infusion Services for Wellstar Health System. Dr. Gould is also our medical lead for the Wellstar Cancer Survivorship Program. Thank you, Dr. Gould.
Okay, thank you, Lena, for the introduction. As a matter of further introduction, I'm a medical oncologist. I've been in practice for over 31 years. My entire career has been practiced in Marietta, Georgia. And I'm also one of the founding members of Northwest Georgia Oncology Centers. So my job here today is to give a overview about how we got to the point where survivorship matters. When President Nixon in the early 70s declared a war on cancer, he did so because cancer was and continues to be one of the leading or second leading cause of death. And back in the early 70s, there's really very little that could be done about cancer, especially if the cancer spread beyond the primary organ. Now, if it was localized in the primary organ, then surgery or radiation was an option, and many times was curative. But the majority of the patients, especially those in the 70s, presented with advanced cancers because at the time we didn't have all the fancy scans that we have today. In the mid 70s, a new specialty was created called medical oncology. And it was created because there was a need for specialized doctors to deal with a new class of therapeutic drugs called chemotherapy. And for the first time in the mid 70s, an advanced cancer called lymphoma could be cured with chemotherapy. Unfortunately, back in those days and into the 80s, undergoing chemotherapy was even a much more difficult ordeal than it is today, primarily because we did not have supportive care drugs, which many of you know, such as Zofran or white blood cell growth factors. And because of the side effects of the chemotherapy, most of the chemotherapy was done in the hospital. And obviously that deterred from the quality of life for these patients. And of course, them being sick all the time was just absolutely heartbreaking. And I helped care for many of those patients in the 80s. Fortunately, things improved dramatically in the 90s. At that time, we had the first major breakthrough that I'll call, and that was the development of a drug that many of you know and love. It's a drug called Zofran. It was the first effective drug to treat chemotherapy-induced nausea and vomiting. In addition, we had the development of white blood cell growth factors. And over the 90s, we had the development of kinder, gentler, and more effective chemotherapy drugs. And that led from patients being treated in the hospital to the patients being treated in the outpatient setting. The second major breakthrough in cancer medicine occurred near the end of the 90s. And we had a new class of drugs that was not chemotherapy, but what we call targeted therapy. In other words, the drug was designed to directly alter the internal workings of a cancer cell and cause it to turn into a normal cell or to kill it. The first drug of this nature was a drug called Gleevec. It was used to treat a fairly uncommon leukemia called chronic myelogenous leukemia, or CML. Prior to the advent of Gleevec, patients with this terrible disease lived 3 to 4 years, and then they died of acute leukemia. Now, with the advent of Gleevec, most of the patients can live a normal length of life, which is a remarkable benefit and advance forward in the treatment of CML. And so the oncologists at the time, came up with this concept, boy, if we could just turn a deadly cancer into a chronic disease, much like a diabetic who's got to take insulin on a daily basis, then that would be a major step forward. And with Gleevec, we were able to do that for the first time. In the mid 2000s, we saw the development of further targeted therapy. Plus, we really started using routinely chemotherapy after surgery or after potentially curative surgery to try to prevent a recurrence of cancer. And we saw a further drop in the cancer death rates. In the 2010s, there was a third major breakthrough in cancer medicine, and that was the advent of immunotherapies. For years, doctors and scientists have always wondered, why doesn't the immune system take care of the cancer? Because it's different and it should be foreign, and the immune system should be able to attack the cancer and get rid of it. And what they discovered was the cancer had a way of lulling the immune system to sleep. And so with the immunotherapy drugs, these drugs are designed to wake up the immune system and have it recognize the cancer cells so that it can attack the cancer cells and destroy them. And immunotherapy has been an important treatment in our war against melanoma, which is a very deadly skin cancer, and lung cancer. In particular, with melanoma, prior to the advent of immune therapy in the mid 2010s, there was no effective treatment for this very deadly disease that often hit people in the prime of their life. So now with the advent of immune therapy, we've seen a very deadly disease all of a sudden become potentially curable. And 30 to 40% of patients with advanced melanoma who have cancer spread beyond the confines of surgery now have the potential for possible cure with these drugs, which again is another remarkable breakthrough. So what does this mean to you? Well, many of you are alive today because of all these wonderful drugs that I just spoke about. 27% drop in cancer death rates from 1999 to 2019. Now, as you can see, the death rates, the blue line is the death rate for men and women. In 1999, it was 200 per 100,000. In 2020, it was about 150 per 100,000. Let me just see if I can point here. The top line there is the death rate for men. And the orange line is the death rate for women. And as you can see, the gender gap in this situation favors the women. Hopefully, with further advancements in cancer medicine, we'll continue to see a decline in the death rates. Now, on the good side, of course, is with the decline in death rate, we also see an increase in cancer survivors. Okay, and obviously I'm talking to the people, at the other end of the meeting here. You are the survivors, you're the victors in your battle against cancer, and we're proud of that. And we want to see you thrive. And that's the whole purpose of this seminar today, is to help you go out there and live your best and healthiest life and continue to remain cancer-free. We want you to enjoy your victory, and we've got a great staff here and great presentations over the month of September to help you do just that. So I appreciate the honor of speaking to you, and I'll turn it back over to Lena.
Thank you, Dr. Gold, for speaking with us. Our first survivorship seminar is on improving lifestyle and healthy behaviors in cancer survivorship. Again, my name is Lena Nehru, and I'm the oncology certified social worker here at Kennestone Cancer Center. Today, we will be defining what healthy behaviors are. We will also be talking about self-care, how to deal with stress effectively, having personal accountability in cancer survivorship. Next, Rachel, our dietitian, will be talking about nutrition and steps we can take to improve our lifestyle and future needs in cancer survivorship. Lastly, Megan Wigington, physical therapist and certified lymphedema therapist from WellStar Outpatient Rehab, will talk about the importance of exercise before, during cancer treatment, and especially in cancer survivorship. So what is a healthy lifestyle? So a less healthy lifestyle, according to Celebi, is all behaviors believed and adopted by individuals to be healthy, maintain health, and be protected from disease. Individuals who adopt healthy lifestyles behaviors are able to improve and sustain their well-being. We will be discussing some of the important health behaviors on the next slide. So over the past few decades, research on health behaviors among cancer survivors has grown significantly. The American Cancer Society has published and promoted guidelines recommending smoking cessation, limiting alcohol consumption, increasing physical activity, and maintaining a healthy body weight to mitigate the detrimental effects of treatment and lower cancer reoccurrence and mortality. We will be focusing on ways to improve healthy behaviors, including the following: reduction of tobacco use, increase in physical activity, limiting consumption of alcohol beverages, weight control, improving diet, limiting sun exposure, and routinely following up with your medical care provider. So the first thing we're going to talk about is the reduction of tobacco use. So cigarette smoking remains the leading cause of preventable illness and death, causing 443,000 premature US deaths annually from smoking-related illnesses, particularly cancer and heart disease, according to the CDC in 2010. Smoking, along with other negative health behaviors, such as drinking, a sedentary lifestyle, etc., can cause havoc to an individual. When we talk about survivorship, staying away and eliminating tobacco use in any form will help you in promoting a healthy lifestyle for you and for your family. Smoking has been linked to cancer of the lungs, the mouth, the larynx, pancreas, bladder, cervix, and the kidney, according to the Mayo Clinic in 2020. A few smoking cessation evidence-based programs are having intensive behavioral programs that include behavioral counseling using a problem-solving approach, along with social support, is effective when offered in an individual, group, or telephone delivery base. Pharmacotherapies such as nicotine replacement, Buspar, and Chantix increase the likelihood of quitting and has been proven effective in varying populations of varying ages, ethnicity, and mental health comorbidities. Utilizing both pharmacotherapies and behavioral programs leads to a greater success in the quitting of smoking. As survivors, we sometimes have physical ailments now that we may not have had before treatment, but now have in survivorship. Moving and being more active helps you during cancer treatment, but it also helps you while you're in survivorship. Regular exercise reduces the risk of lung, endometrial, and ovarian cancer. So I've on this slide, I've put some of the important activities, like some of the things that you can do to help you get moving. But Megan, our dietitian, Megan, our physical therapist, will be talking about physical activity and the importance of that in a little bit. The next thing is about decreasing alcohol consumption. Alcohol intake consistently has been found to be with risk of various cancers, especially the colon, the breast, and liver cancer. Alcohol in moderation may have some health benefits. However, reduction of alcohol and a proper diet and a healthy lifestyle, a person can have a better outlook in survivorship. Excuse me. When survivors revert to old behaviors during cancer survivorship that were unhealthy for them, such as drinking excessively, they tend to become more sedentary, lack movement, and have a greater chance of having other medical issues, including cancer. Pharmacotherapy and counseling in combination have shown to have better outcomes and help a lot of people who are dealing with these issues. Another thing that we're going to talk about is nutrition. This plays a big factor in cancer survivorship. I have added a few slides here of the ACS guidelines about physical and nutrition activity guidelines. So if you want to look about a few of them. Rachel, our dietitian, will be speaking about them shortly. Another concern in cancer survivorship is limiting sun exposure. This would include going to a tanning bed, exposure to UV rays inside and outside. It's important to educate ourselves on the risk of developing skin cancers and what precautions we need to take care of. Educating and reminding ourselves in survivorship that we need to wear sunscreen, protective clothing, and limiting tanning or indoor tanning facilities will help us in the prevention of skin cancers. After you've finished your treatment, it's imperative to continue to see your medical provider for follow-up care and routine care. Your medical provider will let you know when to decrease your visits that you have with them. Having regular screenings and scans as determined by your provider are important in order to keep an eye out for signs of reoccurrence. Seeing the medical provider on a regular basis to help with long-term and late side effects as it relates to cancer is also very important. Barbara Wilson and Lisa Sherman will discuss this further on September 22, so please stay tuned. Keeping your records and being accountable and compliant with your healthcare helps you have better outcomes. Advocating for yourself and for what you need helps you in taking better care of your health. So perhaps the most compelling reason to champion healthier lifestyle among cancer survivors is that these types of behavioral changes have the potential to reduce the morbidity associated with cancer and may even affect the clinical course of the disease. In this slide, it talks about observational studies that have suggested that maintaining a moderate level of physical activity, maintaining your energy balance and diet, and smoking cessation after cancer of the breast and colon may prolong survival. How we deal with stress affects our survivorship. Especially with all of us going through the pandemic, we all have seen how important having self-care is. We all deal with stress differently, so learning how to actively take care of ourselves and learn effective ways to de-stress ourselves will assist us in having better outcomes. Some of the practical things we can do is to take a walk outside and intentionally pay attention to what we see and learning to de-stress ourselves that way. Journaling, and perhaps even taking an earlier nap time, and trying to place some self-care routines that you can do that will help you in keeping you more engaged with things that are happening around you and taking better care of yourself. According to the CDC, research reveals that people who take an active role in their health have a greater feeling of control, are more likely to adopt positive health behaviors, and experience better outcomes. Empowerment can result in more people getting cancer screenings, a greater feeling of control during cancer and diagnosis and treatment, and better care plan for cancer survivors. Lastly, when we talk about managing and reducing stress for a survivor, we can implement a few of these tips. So being aware of our limits, asking for help. There's nothing wrong in asking. We're all here to help you all. And prioritizing and breaking down tasks into more manageable ways will always help us in dealing with stressors. Focusing on things that you can control, and understanding that there's going to be stuff that you're not able to control, and learning to control how we respond to actions. Seeking financial advice when necessary. Exercising regularly, spending time outside, scheduling social activities, joining a support group, and writing in a journal are some of the ways we can manage and reduce stress. I've included some resources of other programs that provide information on cancer survivorship. If you would like me to send you more info, please email me at lena.nero@wellstar.org. And I have added some of the references that I have used. And then this is my contact information. It's lena.nero@wellstar.org. And my phone number is 470-793-7436. Thank you all. Our next speaker will be Rachel White, and she will be talking about nutrition and cancer survivorship. Thank you, Rachel.
Thank you, Lena. All right, my name is Rachel. I'm the oncology registered dietitian with WellStar's Cancer Network. I will include my information at the end like Lena just did. So if you have questions that maybe are pertinent to your treatment, or questions that may not apply to anyone else, or maybe something you're not comfortable asking over the presentation, you can just email me, call me, and we can discuss those things offline. All right, so I'm going to go over the nutrition recommendations. These are not just my recommendations, they're put out by the American Institute of Cancer Research, almost identical to the recommendations from the American Cancer Society. They are cancer prevention guidelines. So if you look on their website, sometimes people ask me, they'll look on the website and they see that there's a lot of information for prevention. They're also appropriate for survivors. So whether you were diagnosed 2 months ago or 12 years ago, these recommendations are basically the same. So we really want you to follow these as close as possible, not only for cancer prevention and prevention of recurrence, but also it will reduce risk of other disease. So disease like cardiovascular disease, heart disease, diabetes, these recommendations are almost identical to those as well. So the first one is to be a healthy weight. So excess weight can increase your risk of many health conditions. Those I just described are some of them. Basically, when it comes to cancer, increased body fat is increased inflammation. And so inflammation can cause many types of cancer. Increased estrogen production, if you're a breast cancer survivor or maybe some other hormone positive cancer, increased estrogen is not a good thing. High levels of insulin and other hormones are present when you have excess body weight. So we do try to get your weight down somewhere between a BMI of 21 to 23. A lot of times when I would tell people, we've got to get your weight down to a BMI of 23, they may think this is very unrealistic. If your BMI is somewhere in the 30s, you're starting out with a higher BMI, any reduction down in BMI is helpful. So sometimes people think, my BMI is 35, there's no way I'm going to get down. You may not get down to this lower range to the BMI of 21 or 22, but any reduction, even 10, 15 pounds will help reduce your risk. Again, back to the weight, these are some of the cancers we know that are very strongly related to weight. Breast cancer, endometrial cancer, any type of head and neck cancer, ovarian, prostate, any gastrointestinal cancer, so stomach, colon, rectal, all of those have a very strong tie to obesity, and even just being overweight, being beyond that BMI of 23. So I talk very frequently with people attempting to get their weight down. They want to do everything that they can. A lot of times I'll meet with people very early on in their treatment because the cancer diagnosis has been a wake-up call. Like, what can they do to what can they do to get healthier? What can they do to decrease their risk of recurrence? And then sometimes I'm meeting with people that are coming back, maybe they're coming back to meet with their medical oncologist, and it's been 5 years since they were diagnosed, and they want to do anything they can. This is where we always start. So we always start with eating mostly plant-based foods. This is important for several different reasons. One reason is because plant-based foods help people get their weight down. Another reason is if you're taking in less animal protein, you decrease your risk of recurrence naturally. A lot of people have, very high intake of beef and pork and chicken, and we really want you to balance your plate to look more like this plate. So 2/3 of your plate at least 2/3 of your plate should be from fruits, vegetables, whole grains, beans, any plant-based food would be ideal. Like, if you think about those plates that you would get like at a barbecue or a picnic, and they're already separated, one of those little sections should be your protein. So a lot of times we fill up that big part with steak or with barbecue or with ribs. You really want one of the little sections to be your chicken or your fish. And then fill the rest of it with vegetables, particularly non-starchy vegetables. So salad, broccoli, any type of greens would be ideal. Here you see kind of what the recommendations are. 3.5 to 5 cups of fruits and vegetables per day. That may seem very realistic if you're only doing one fruit or half a cup of vegetables per day, but that's something you can increase gradually. Honestly, we don't want you to go from no vegetables to 5 cups of vegetables, mainly because of the fiber. Like it shows right here, 25 to 30 grams of fiber per day is recommended. We don't want you going from eating, 5 or 10 grams of fiber to eating 30. People do have, I've had patients in the past that would take my recommendations very seriously, and they bump up the beans and they eat all kind of nuts, and then they're having some gastrointestinal issues. So increasing it gradually, going from, if you're eating, you're eating 3 cups of fruits and vegetables, increase that slowly, but do really make an effort to eat more of the fruits and vegetables and whole grains. So if you follow any social media or you follow any of the fad type diets, grains get a really bad rap. So things like breads and cereals and pasta, very frequently I meet with people and they tell me, oh, I cut out all the breads, I cut out all the grains. And you're really not doing yourself a favor, because the grains are where you get a lot of your energy. So when people are also telling me they're very tired, a lot of times we look at their diet and they're just not getting enough of these whole grains in their diet. So not only are they high in fiber, they're also high in antioxidants, which are cancer fighters. And they're also, really good sources of energy that you can't get just from the fruits and vegetables. Another way to bump up your plant-based foods are beans, lentils, peas, any type of beans. When I tell people this, they always ask what kind. Really anything. Green beans really don't have the fiber. They don't have the antioxidants, say that black beans, pinto beans, lima beans would have. So these are some of the things. Obviously, I like beans. That's something that I recommend very frequently. These are not by any means foods that you absolutely have to eat. These are just ones that we do know from research have a lot of benefit, particularly with cancer. So they're very high in antioxidants, very high in fiber, high in vitamins, and they'd be good for you to add on. But think outside of the box. If you're one that typically does green beans and corn and peas, try to find ways to work in other vegetables. So cruciferous vegetables, this would be broccoli, cauliflower, Brussels sprouts, dark green vegetables. So you don't have to just do kale. Kale gets a lot of publicity, but you can do collards. Romaine lettuce would be a good source of dark green vegetables. Things like garlic, things like tomatoes, squash, soy. I get a lot of questions about this. If you're a breast cancer patient, you can eat soy. It's an old recommendation to stay away from the soy. There is really no research showing that soy can harm breast cancer patients or act as a estrogen source. You do want to limit it to a couple of times a day, and you want to stick with real food sources. So don't take soy supplements or soy protein powder. You want to eat like tofu and soy milk and edamame to get those sources in. Limit your consumption of processed foods. So this picture over on the right is what you would want to eat. This would be, eating more real food versus chips and candy. And, processed foods very frequently are really low in nutrients, high in calories. You want to increase your plant-based foods, again, back to that. And you want to stop the store's perimeter. So when you look at this picture over on the right, you think about, lean sources of meat, think about eggs, dairy, the produce section, anything that has to be refrigerated. Obviously, there's some things around the perimeter that are not so healthy. So you have your ice cream, you have, maybe the bakery would be around the perimeter, but limit those foods as much as you can and eat as many of these real foods as possible. That's where you get all your fiber, your antioxidants, and all your benefit. Limit consumption of red and processed meat. This is one that a lot of times people have questions about. I think it's been a little bit more, it's been in the media quite frequently, particularly processed meats. As far as the red meat goes, you want to limit that to 12 to 18 ounces per week. So just so you know, a deck of cards is 4 ounces. So if you think about your serving of beef, or you think about your hamburger or your pork chop, if it's about the size of a deck of cards, which typically it's a little bit bigger, but say it is the size of a deck of cards, you could do that 3 times per week. So anything like, barbecue, ribs, lamb, hamburgers, any type of ground beef, you would want to limit that, 2 or 3 times per week would be ideal. Increase more of your lean sources like fish, chicken, eggs, and then back to things like the beans. Beans are a good source. The soy would be a good source, an alternative to doing so much red meat. Processed meat, so things like hot dogs, bacon, any type of deli meat. This surprises people. I think a lot of times people think they're doing really well by having a turkey sandwich every day for lunch, or they're doing well by having, doing something like boar's head because it has less of the preservatives. There is still something in there to keep it stable. So if you think about even your boar's head, even if you get it sliced in the deli at Publix, it's still stable in your fridge for weeks. And that's not really normal. There's something added there, typically a lot of salt, typically some preservative, and a lot of those things are carcinogens. So you want to eliminate the processed meats if possible. People always ask for alternatives. things like chicken salad, egg salad, tuna salad, doing a nut butter, so like almond butter, peanut butter. You can, roast your own chicken and slice it. I have people that really love turkey and they have roasted turkey and sliced it. And then think of other ways. You don't just have to do sandwiches. Think of other things that you could eat for your lunch. Obviously, sugar, a statement that I hear at least twice a day, I would say, is, does sugar feed cancer? Sugar does not feed cancer. It is not going to make it grow. It is not going to make it spread. It's not going to make it harder to treat. People look at me and I know they don't believe me, but there is not solid research that the sugar is going to feed just your cancer. Sugar is a very fast acting energy source. So if you think about it, if you eat a donut on an empty stomach, it makes you feel good for like 30 minutes and then you crash. And that's basically what it does to your cells, healthy cells and cancer cells. So it's not going to target just your cancer cells and make them grow rapidly, but it does not really provide you any nutritional value. So my concern with the sugar is not that it's necessarily going to make your cancer spread, but it's not going to make you feel good. So if you're one of our patients that's wrapping up their treatment, you need to do everything that you can to have energy, energy that will sustain you. That's why we really push you to, eat more complex carbs. So back to the whole grains, back to the fruits and vegetables. The sugar just does not really give you any nutritional value. We do tell people, though, to be aware of hidden sugars. So a lot of times people think they're doing a really, great thing by eating cereal or eating yogurt. A lot of those are really packed with sugar. So read your food labels, look at your cereal, do something that has, more fiber, less sugar, because it's going to keep you full longer. It's going to give you energy longer. Yogurt, there are a lot of options that have less sugar. So like a Greek yogurt that's higher protein and less sugar would be ideal. And then beware of condiments. So things like barbecue sauce, pasta sauces, any type of salad dressing, those can be really high in sugar and people don't realize that. As far as the supplements go, I get a lot of questions about supplements too. We don't want you to use supplements for prevention. So ideally you would choose real food first. Again, back to doing fruits and vegetables, back to doing lean meats. The problem with supplements is they don't really, they're not a complete food. They're not giving you fiber. They're not giving you vitamins. A lot of times, say if you're taking vitamin C, it's just vitamin C. It's not going to give you any minerals or any phytochemicals that are the cancer fighters. Obviously, there's some such situations you need to take your supplement. So if you're pregnant, if you're elderly, if your doctor has told you you're deficient, say vitamin D or iron, by all means, then you need to take those supplements. But frequently I have people come in and they're taking antioxidants. They think they're doing themselves a favor, but we'd really rather you take it, eat the food first. Limit your alcohol consumption. So there is a recommendation or a limit. Men 2 drinks per day, women 1 drink per day. The problem with alcohol, really, ethanol is a carcinogen. So any amount that you drink can lead to DNA damage. So we really recommend, the less you drink, the better. A lot of times people, we have the conversation, they've heard that a glass of red wine is good for their heart health. That may be true, but grapes are too. I'd rather you do, fruits. I'd rather you find other sources than doing the alcohol. Sometimes people will limit just to the weekend or limit to special occasions. But the less alcohol you drink, really the better when it comes to cancer prevention and, prevention of recurrence. All right, so that's basically it. It all really boils down to just a few things. Eat more real food. I know every slide, it seemed like I was telling you to eat more fruits and vegetables. People are always surprised when that's really what it boils down to. You need to eat more real food. leaner sources of meats. This is not included in the recommendations, but I couldn't let this presentation go and not tell you to drink more water. The more water you drink, the better off you will be. People just do not drink enough water. Ideally, about 8 cups of water per day for most people. Sometimes people a little bit more, especially if you're still in treatment right now. Do you plan ahead? You can't do any of those things we just talked about if you're not planning and you're not going to the grocery store and you're not making a list and shopping. And the last one is to focus on simple changes. I feel like a lot of times I go through these tips with people and they're overwhelmed and they just don't even know where to start. Pick 1 or 2. So if you know that sugar is a problem and you eat way too much sugar, start there. Like start really, cutting the sugar back to maybe once a day or just, a couple of times a week. If you know that you eat way too much red meat, find ways to cut the red meat back, maybe eating that just a couple of times a week. And by all means, you can reach out to me. I'm available by appointment. I do a lot of phone consultations right now, or you're welcome to come in. This is my contact information. You can call me or email me and we can connect if you want to learn more about all of this. These are my references here. Thank you very much.
Thank you, Rachel. It was very informative. Our last speaker is Megan Wigington, physical therapist and lymphedema therapist from Wellstar Health Systems.
Thank you, Lena. Like she said, I'm Megan Wigington. I'm a physical therapist and I'm also a certified lymphedema therapist. And today I'm just going to go over exercise or physical activity and how that can benefit you as a cancer survivor or even somebody who may be actively going through cancer treatment. So Dr. Gould actually talked a lot about this, how there's been an increase in cancer survivors in the US and across the world. And with that increase in numbers of cancer survivors, there's also a growing need of trying to address some health challenges that can be related to the cancer diagnosis itself or even those cancer treatments. So some things that can be those health challenges are depression, anxiety, fatigue, lymphedema, poor sleep, having reduced physical function, and then also reduced quality of life. So these are all things that maybe you've already gone through. You may be going through some of these health challenges currently. So we want to try to address this so you can get back to your normal. So what can we do to try to address all of those health challenges I just mentioned? One of the major things that we can do is to try to incorporate some exercise and even some physical activity into our daily routine. So I want you to take my word for it, but I did provide some study results, just linking the great benefits and positive benefits of exercise. So a lot of studies have recently been showing that exercise maybe before, during, or even after your cancer treatments can be very, very helpful. They have been shown to reduce depression and anxiety. They've also been shown to increase your energy and your strength, all things that sometimes go down after cancer treatments. And then also trying to help reduce pain levels. Another great benefit of exercise is that it can actually help to try to make your treatments a little bit more effective. So they've shown that exercise during treatment can change your tumor's microenvironment. So that's the blood supply. And it also can help to try to make a stronger anti-tumor activity in your immune system. So try to help boost it up as you're trying to reduce those cancer cells. And of course, another really great benefit of exercise is weight management. And this is something that Rachel has already kind of mentioned and discussed, that it's so important to try to maintain a nice, healthy weight. We see that obesity is a major risk factor for cancer. And we want to try to help limit any sort of cancer recurrence, any future cancer-related deaths. So we want to make sure that we're not only eating very healthy, like Rachel was mentioning earlier, but also trying to become a little bit more physically active and exercising a little bit more. That helps us to also try to maintain a good, healthy weight. So just another thing, back in 2018, there was a big group of people through the American College of Sports Medicine. They got multiple experts together to discuss and review hundreds of different studies that were really focusing on exercise or physical activity and how can that be used towards cancer prevention or even cancer control. So the main results of all these different studies across the world involving cancer and exercise, they found that exercise is safe for cancer survivors and current cancer patients. They also found that it's really important for cancer patients and those who have already gone through cancer treatment to avoid inactivity. So it's really been shown that the best effects are when you are maintaining an active lifestyle. So the best effects have come from a moderate intensity aerobic training and/or resistance exercise during and after cancer treatment. And some of those positive effects from the exercise was that it was showing that the people that participated in these studies had reduced anxiety. It helped to reduce their depression and their fatigue levels. And it also helped to try to improve their overall quality of life and any physical function that maybe that could have declined after their cancer treatments. So how much exercise is recommended? So this is coming from the U.S. Department of Health and Human Services. This is their physical activity guidelines for Americans. So they recommend 150 to 300 minutes of moderate intensity aerobic activity or exercise, or 75 to 100 minutes of vigorous aerobic activity, or some sort of equivalent combination of each. And that's per week, not every day, but for over a week span. That's about how much time you should try to spend being a little bit more active. Of course, you don't need to do 150, 300 minutes of activity all in one day or over a span of 2 or 3 days. Spread it out, especially when you're trying to get started getting back into exercising a little bit more, having a little bit more physical activity. We never want to start from doing nothing, jumping right into running a marathon. We have to work our way up to it. The other recommendation they give is to at least incorporate about 2 days of muscle strengthening activities in your week, and also some balance training just to try to help with improving coordination and overall function. So what is aerobic exercise? So basically, aerobic exercise is when we use aerobic metabolism, and that's incorporating oxygen into our cellular reactions in order to provide ourselves with more energy in our bodies. So basically, when you think of aerobic exercise, think of cardio, something that's going to increase your heart rate, get you breathing a little bit harder and faster. And we want to do this because it's helping to improve our body's efficiency in delivering that oxygen to the rest of our body to provide more energy to do our normal daily tasks. So some really good examples of aerobic exercise are biking, walking, like maybe a little bit faster just to get our heart rate up, swimming, dancing, running. You can even hike. Water aerobics is great too. Anything that's going to get you moving, get your heart rate increasing a little bit, breathing a little heavier. That's going to help to try to get that cardio into your daily routine. The next thing is resistance exercise. So basically, this is when we're trying to get our muscles to contract against some sort of external resistance. And our hope is to really try to help to improve our tone, our muscle mass, or even just our muscles endurance. So a lot of times when I'm working with patients, they always think, oh, I just need to buy a bunch of big dumbbells or use really heavy weights. And that's not what you need to always do, especially when you're trying to just get back into a routine or start off with incorporating some strengthening into your daily routine. We want to try to use something that's a little bit lighter to start off with. You can do any sort of exercise that incorporates body weight. So that's like squats, push-ups. That's still a resistance exercise. Instead of dumbbells, you can use something like resistance bands. There's a lot of different resistance levels. So you can start off kind of light and then work your way up to a little bit of a harder resistance as that begins to be easier. I have a lot of patients, they don't have very light dumbbells or hand weights at home. And I say, well, let's start with using just some water bottles. Fill up water bottle, that's going to be your hand weight. Or using some cans of soup or cans of vegetables. That can be used as resistance as well. So another big thing that I like to touch upon is cancer-related fatigue. I find that that is a really big complaint with a lot of my patients, is all this fatigue that comes after their cancer treatments or even maybe during your cancer treatment. So what is cancer-related fatigue? It's distressing, persistent, subjective sense of physical, emotional, and/or cognitive tiredness or exhaustion related to cancer or cancer treatment that is not proportional to recent activity and interferes with your usual functioning. So when you're comparing cancer-related fatigue to maybe just fatigue with like a healthy individual, someone who hasn't had cancer, it's way more severe, way more distressing, and it's a lot less likely to be resolved or relieved with rest. So you may be going through this right now. Your energy levels are just not what they used to be, but this affects a lot of cancer survivors at all stages. And of course, like I mentioned earlier, it can be caused by just cancer itself or the cancer treatment. So we really want to try to combat this cancer-related fatigue. And a lot of research has shown that one of the main ways to try to get this cancer-related fatigue to reduce is through physical activity and exercise. So what are some of the signs and symptoms? And I'm just going to touch on a couple of these. You may be feeling some weakness or heaviness in your legs or arms, feeling a little irritable, really exhausted, even after you had a good night's sleep. These are all things that can be showing you I am having some sort of fatigue, maybe related to some of my cancer treatments. So what can we do to try to conserve your energy? So let's follow the 4 Ps. We want to prioritize, we want to plan, pace, and then position ourselves in order to try to help conserve our energy and combat that fatigue level. So the first one, prioritize. What you want to do is you want to decide what is really important, what needs to be done now, and what can wait to be done a little bit later. That's going to help you to make sure you have enough energy to get what's the most important done at this moment. And if you end up getting way too tired to try to complete any of the other tasks that you need to get done, it's okay. They're not as important. They can get done a little bit later. The next one is we want to try activity, extra trips. We want to reserve our energy. So if you know you need to go upstairs to do some laundry, maybe also need to make the bed. Let's do that all at one time so you don't have to be going up and down the stairs so many times and cause yourself to get tired too quickly. You want to alternate heavy and light tasks. We also want to make sure that you're kind of spreading out some of these different things throughout your week instead of trying to cram it all into one day. And make sure that you get good rest and ask for help. You have support groups, you have friends and family. Don't be afraid to ask for a little bit of assistance, especially if you need it. The other thing, this is pretty easy, pace. Don't push it. Don't rush yourself. Take your time. Make sure that you are breathing, right? We don't want to hold our breath. That's using some energy. We want to try to listen to our body, know when you need to take a rest break. If you're feeling tired, heavy in your limbs, sit down, take a break, come back to it later. And positioning. So that's really positioning your body. Bending and reaching a lot can use up a lot of your energies, and we want to maintain a nice upright posture to get more oxygen to our lungs. Being slouched makes it harder for us to breathe, harder for our lungs to work. So we want to make sure we're sitting upright and sit as often as you can. That reduces your energy use by about 25%. So that's going into, like, if you need to chop up vegetables for dinner or you need to fold the laundry, try to do it sitting instead of standing and use less of your energy. Yoga has been really popular lately, especially with cancer survivors, to try to get a little bit more physical activity into their daily routine. And I really like this because it allows for you to become a little bit more mindful, and it's good with really good breathing techniques. It also has been shown to reduce stress, pain, and your anxiety. It also helps with improving your overall mobility and function. I really like this because you can easily modify some yoga. So you can do chair yoga if maybe you don't have enough energy levels to try to do any standing yoga. You can do different intensity levels. Maybe you need to start beginner, or maybe you're ready to go into a more advanced level. So that's something to consider when you're trying to think about what are some fun activities to get into my daily routine. All right, so how do you get started? How can you start to get some exercise, more physical activity? First, talk with your physician about whether it's safe for you to try to exercise. We want to make sure heart and everything's all good. Also, think about seeking out a physical therapist or an occupational therapist in order to assess you, right? That's our jobs. We're experts in movement and your function. And we can try to see, like, if you have any problems with reaching overhead or doing, bathing, dressing, we can address those, as well as try to develop a personal designed treatment program to get you back where you want to be and maintain your daily goals. Try to look into doing activities that you really like and you enjoy. When you make exercise into something that's a chore, you end up you just lose out. You're not going to do it anymore. And we're going to lose out on trying to get more of that physical activity into your system. Again, avoid inactivity. We want to try to get back to your normal daily, ADLs, your activities of daily living, and try to follow those 4 Ps to try to address any fatigue that you may be feeling. Again, here's some of my references where I got my information from. And please feel free to contact me if you have any questions. This is my email and my phone number. I'm more than happy to talk with you. Thank you.
Thank you, Megan. We hope the seminars have been helpful to you all, and a short evaluation will be sent to you to complete. We will now review some of the questions that you have asked. Okay, so I'm going to move forward because it seems that we don't have any questions as of yet. But if you have any other further questions, you can always email me at lena.nehru@wellstar.org, and I can send it to the speakers. Oh. So one of the questions that came up are, what are the 4 Ps that Megan was talking about? So let me have Megan talk to you about it.
Okay, let me see real quick. So we talked about prioritize, plan, pace, and position. Those are your 4 Ps of trying to conserve your energy. So kind of like we talked about, plan your activities, pick something important that needs to be done now versus later. Take your time, so pace yourself. Don't try to cram it all in one at one time. And then of course, trying to position. So that's positioning your bodies. Try to sit and perform some tasks for standing as often as you can. But those are the 4 Ps that we want to try to touch upon. Yes. Lena.
Lena, can you tell us when the next one of these will be held? And also, Lena, are we going to be able to view this later on if someone wants to share it with their friends?
Yes, we'll be able to view these slides once we finish all of the presentations, the next 3 that are coming up. It'll be, we'll have it ready for you all to view at a later date on the WellStar YouTube page. So as per Dr. Stein, we're going to actually tell you when the next presentations are coming up. So let me just move it to that page. Okay. So I hope you all have enjoyed the presentations that we've had. Our next speaker and moderator will be Dr. Stein, and it'll be part 2. It's on September the 15th, 11 to 12 p.m. And the topic is psychosocial issues in cancer survivorship, a seminar with mental health experts about the psychosocial challenges during and after cancer treatment. Part 3, which will be held on September 22nd, 11 to 12, will be on long-term treatment-related side effects. You'll be getting a Zoom invitation for all of these as the time approaches. So thank you again. Remember, a short evaluation will be sent to you, and have a great afternoon and the rest of your day. Thank you.